Leg cramps waking you up at night are not random after 60. And if a calcium tablet is already part of your routine, you may be closer to the answer than you think, but still missing the real reason they keep coming back. Because here's what no one sat you down and said. You can swallow calcium every single morning. You can see the bottle on your counter and believe you've handled it. And at 2 in the morning, your calf locks so hard you can't move your foot. That's not a coincidence. That's a signal. And what it's telling you is not what most people assume. For years, the standard answer has been simple. Night cramps, drink water, eat a banana. Maybe it's just your age. Most seniors are told to think dehydration, potassium, or wear and tear, and to move on. However, guidance published by the Mayo Clinic and the NIH Office of Dietary Supplements points to something more specific. After 60, the real problem with calcium isn't whether you're taking it. It's whether your body can actually absorb it, activate it, and deliver it to the muscle at the exact moment the muscle needs to relax. And that distinction between swallowing calcium and using calcium is the one almost nobody explains. Not on the bottle, not in the 5-minute appointment, not in the article you skimmed last Tuesday at midnight after the cramp finally let go. My name is Dr. David Collin. I spend my time digging into the food and supplement side of leg cramps, the part that gets skipped, rushed, or never brought up at all. Now, everything I share here is for educational purposes only. Always discuss changes with your own doctor. That's not a formality. I mean it. Your doctor knows your history. I don't. What I can do is walk you through the research clearly, the way it should have been explained to you a long time ago. If that sounds like something you need, subscribe to this channel. Because I cover the mineral and nutrition side of leg cramps here in plain English. And most seniors are never given that explanation. Not once. After 60, everything changes, and most people aren't told why. Today, that changes. By the time I'm done, you'll know exactly why calcium can look covered on paper and still fail your legs at 3 in the morning, and what you can do about it starting tonight. So let me take you inside the muscle. Not with a textbook, with the truth of what's happening to your body right now. The thing you can feel, but nobody's named for you. Every time your calf contracts, every single time, calcium is part of the trigger. That's its job. Calcium ions flood into the muscle cell and tell it to fire, to squeeze, to tighten. That's normal. That's how you walk, how you stand, how you climb a step without thinking about it. But here's the part that matters. The muscle also has to stop. It has to release. And that release, that moment when the tightness lets go, depends on calcium being pulled back out of the cell and the whole signaling system resetting cleanly. If there isn't enough usable calcium circulating in the right form at the right time, the signal gets stuck. The muscle fires, and it doesn't get the memo to stop. That's a cramp. That is exactly what is happening at 2, 3 in the morning. Not because you're old, not because you forgot to drink water, because the mineral your muscle needs to complete the cycle, to finish the job and let go, wasn't available when the signal came. Think of it this way. Calcium is like the key that starts the engine and the key that turns it off. If the key's missing when it's time to shut down, the engine just keeps running. The muscle just keeps squeezing. And you're lying there in the dark grabbing your calf, waiting for it to pass, wondering why it's getting worse. So why doesn't the calcium supplement fix it? You're taking it. It's on the nightstand. You swallow it every morning. Why is the muscle still locking up? Because swallowing calcium and delivering calcium to the muscle cell are two completely different events. And after 60, the distance between those two events gets wider. A lot wider. And almost no one explains why. The NIH Office of Dietary Supplements is clear on this. Calcium absorption declines with age. After about 60, changes in stomach acid, changes in vitamin D status, and changes in the gut itself all work against you. Your body doesn't pull calcium from food or supplements the way it did at 40. It's less efficient. It's pickier, and the margin for error gets smaller every year. So a pill that used to cover you might not anymore. Not because the pill changed, because your body changed. And nobody updated the instructions. Here's where it gets serious. Calcium doesn't act alone. It can't. For your body to absorb calcium from the gut into the blood, it needs vitamin D. That's not optional. That's the mechanism. The NIH and the National Academy of Medicine, formerly the Institute of Medicine, have published extensively on this. Without adequate vitamin D, calcium absorption can drop significantly. Some research suggests absorption can fall by more than half when vitamin D is low. And how many seniors have low vitamin D? The answer is a lot. NANS data, that's the National Health and Nutrition Examination Survey run by the CDC, has consistently shown that a large proportion of adults over 60 in the United States have vitamin D levels below what's considered sufficient, especially in winter, especially if they spend most of their time indoors, especially if nobody's checked. So picture this. You're taking calcium. You believe it's handled, but your vitamin D is low and nobody tested it, or it was tested once and never followed up. That calcium you swallowed this morning, a significant portion of it may have passed through you and used, gone. And tonight, the cramp comes again, because the muscle never got what it needed. You know now why this starts. But knowing where it starts is only part of the story. Where it leads, that's what no one ever showed you. Because calcium absorption is just the first door. There's a second one, and this is the one that catches people completely off guard. Once calcium makes it into your bloodstream, it still needs to be regulated. Your body has to decide how much stays in the blood, how much goes to bone, and how much is available for muscle and nerve signaling. And that regulation, that fine-tuned balancing act, depends on another mineral, magnesium. Magnesium controls the channels that let calcium in and out of the muscle cell. If magnesium is low, and in American adults over 70, the USDA's dietary intake data suggests a significant number aren't meeting the estimated average requirement. Then the calcium you absorb doesn't behave properly at the muscle level. It gets in, but it doesn't cycle out cleanly. The off switch doesn't work as well, and the cramp has room to start. Most seniors never connect this to that. Today you will, because the cramp you felt last night wasn't about one missing mineral. It was about a chain. Calcium that wasn't absorbed well because of low vitamin D. Calcium that wasn't regulated well because of low magnesium. And a body that's been running on incomplete mineral coordination, possibly for years, without anyone pointing at the whole picture. And there's one more piece. One that makes me genuinely frustrated that it's not talked about more openly. Certain medications that millions of seniors take every single day, can change how the body handles calcium. Proton pump inhibitors, the acid-reducing drugs commonly prescribed for reflux or stomach issues, have been flagged by the FDA and discussed in multiple clinical reviews. Long-term use may reduce the absorption of certain forms of calcium, particularly calcium carbonate, which is the most common form found in over-the-counter supplements. And nobody warns them. You pick up the supplement. You pick up the prescription. They sit next to each other in your medicine cabinet. And nobody tells you that one might be quietly making the other less effective. That's not a conspiracy. It's a gap. A communication gap between the pharmacy counter and the supplement aisle. Between the specialist who prescribed the acid reducer and the general advice to take calcium for your bones. The information exists. It's published. It's in the FDA's own safety communications. But it doesn't make it to your kitchen table. And your legs pay the price at night. I want you to do something for me right now. Drop a letter in the comments. If you still believe night leg cramps are mostly just age, dehydration, or a potassium problem, drop the letter A. If you believe they may be tied to calcium balance, absorption, and how your body uses minerals after 60, drop the letter B. I read every single comment personally. Let me know where you stand. And now, here's the part I've been building toward. Everything I just told you is real, and it matters. But there is something that changes all of it, something almost no one talks about. And once you understand it, you will never look at your calcium routine the same way again. The real story with calcium after 60, for most seniors, is not that they forgot to take it. It's that their body is not using it well enough when the muscle needs it most. And this is where the phrase calcium deficiency actually misleads people. Because deficiency sounds like empty, like zero, like you haven't been trying. But what's really happening for many seniors is more like a delivery failure. The calcium is entering the body, maybe through food, maybe through a supplement, maybe both. But between the moment it hits your stomach and the moment your calf muscle needs it at 2 in the morning, something breaks down along the way. Low vitamin D means less absorption. Low magnesium means poor regulation at the muscle. An acid reducer taken at the wrong time means the calcium carbonate tablet doesn't dissolve properly. A supplement taken without food means the gut doesn't have the acid environment it needs to break it down. And the result? Your blood calcium stays stable, because your body will pull calcium from your bones before it lets blood levels drop. but the fine margin of mineral availability for nighttime muscle signaling gets thinner and thinner and thinner until the cramp hits. This is not age. This is something your body is doing, and we can fix it, not by guessing, not by doubling the dose, by understanding the delivery chain and asking the right questions. I'm telling you this because nobody else in this space will. The supplement bottle doesn't say, check your vitamin D first. The prescription label doesn't say, this may reduce your calcium absorption. The 5-minute appointment doesn't have time to draw the full map from your stomach to your calf at 3 in the morning. But that map is real, and you're looking at it right now. Now, and I need to be very direct here. Everything I'm about to walk you through is educational. If you're taking acid-reducing medications, thyroid medication, osteoporosis drugs, diuretics, or if you've ever been told you have kidney concerns or a history of kidney stones, please do not change anything on your own. Talk to your doctor. Talk to your pharmacist. Bring them this information. Ask the questions. That conversation is where the real change happens. Not here. There. What I can give you is the framework so you walk into that conversation prepared, knowing what to ask, knowing what to look for, and knowing why the cramp keeps coming back. So here's what I tell someone in my own family. And I mean that. First, stop assuming every night cramp is just age or just potassium. It might be, but if you've tried the water, tried the bananas, tried stretching, and the cramps still wake you up, it's time to look at the calcium side. Not just whether you're taking it, whether it's actually working. Second, look at your calcium food patterns before you look at the supplement. Yogurt, milk, or kefir if your stomach tolerates it. Calcium-set tofu. Not all tofu. The kind made with calcium sulfate. Check the label. Canned salmon or sardines with the soft bones still in. That's where the calcium actually is. And fortified foods, but verify them through the USDA Food Data Central database, because not every fortified label means the same thing. Why food first? Because calcium from food is absorbed more steadily. It arrives with other nutrients. It doesn't depend on one pill dissolving perfectly in the right acid environment at the right time. The American Journal of Clinical Nutrition has published research supporting that food source calcium tends to be absorbed in a more sustained way compared to isolated supplement doses. It's not that supplements are bad. It's that food gives your body a broader, steadier signal. Third, ask about the blockers. Is your vitamin D adequate? Has it been tested in the last year? Is your magnesium intake consistent? Not just from a supplement, but from dark leafy greens, nuts, seeds, whole grains. And this is the hard one. Are any of your medications interfering with calcium absorption? That question alone is worth a 10-minute pharmacist conversation, and most pharmacists will answer it for free. Fourth, if you're using a calcium supplement, discuss the form and the timing with a doctor or pharmacist. Calcium carbonate needs stomach acid and food to absorb well. Calcium citrate is generally absorbed more easily regardless of food, but it often requires more tablets per day. The right choice depends on your specific situation, your other medications, and your stomach. Don't guess from the bottle. Ask someone who can match the form to your body. And fifth, start tracking. Write down when the cramps happen, what you ate that day, what time you took your calcium, food, or supplement, what medications you took, and when. Even 2 weeks of that kind of record can reveal a pattern that neither you nor your doctor could have seen otherwise. The cramp isn't random. The pattern is there. You just haven't had the framework to look for it until right now. So to be clear, the goal after 60 is not just taking calcium. It's making calcium work where your muscles need it, when your legs need it most. That's the difference between a routine and a result. And that's what doctors missed. Not out of carelessness, out of time, out of a system that separates the bone conversation from the muscle conversation, from the supplement conversation, from the medication conversation, and never puts them in the same room. You just put them in the same room. Right now, in the last 22 minutes, you connected what most people never connect. Calcium to absorption, absorption to vitamin D, regulation to magnesium, interference to medication timing, and all of it, every link in that chain, to the cramp that wakes you up at night. Your doctor never told you this, but I will, every single video. That's what this channel is for. Now, before I let you go, there's one more thing. And this might be the most important part of everything I've said today. If calcium is being blocked by low vitamin D, undermined by missing magnesium, or disrupted by the wrong medication timing, Taking more calcium without asking why doesn't solve the problem. It gives you confidence without results. And that gap between believing you've handled it and still waking up in pain is the most frustrating place a senior can be. Night leg cramps after 60 don't improve because of one pill. They improve when calcium is understood as part of a full mineral system: absorption, regulation, delivery, timing. Not one piece, the whole chain. But now that you understand why calcium can fail, there's another mineral that quietly decides whether calcium can calm the muscle at all. If you miss that piece, the cramps can keep coming back no matter how much calcium you take. I cover exactly that in the next video. Watch it now.